In a groundbreaking latest research, scientists have unearthed a connection between a common gut bacteria infection and an increased risk of Alzheimer's disease. This discovery could revolutionize our understanding of one of the most feared neurological diseases, and most importantly, will open up great avenues for its prevention. Today we will focus on what you should do to find out if you have this bacteria and what preventions and treatments are available. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and functional medicine certified physician. And before we get started, please like, subscribe, and share. So let's get started. You may have heard of this bacteria in the context of stomach ulcers or heartburn or stomach reflux. This bacteria is called H. pylori or Helicobacter pylori. That is the full name. H. pylori is a type of bacteria that primarily infects the stomach lining, and it is a known cause of stomach ulcers and chronic stomach inflammation called gastritis. This bacteria can live in your stomach silently without any symptoms, or it can lead to a variety of symptoms. So let's look at the common symptoms of H. pylori. Stomach pain, a burning or aching feeling in the stomach, especially when it's empty. Nausea, or just feeling sick to your stomach. Bloating, frequent burping, loss of appetite, indigestion. It usually manifests as discomfort or heartburn after eating. Peptic ulcers, painful sores in the stomach or in the upper small intestine. So how we diagnose this H. pylori? There are several tests. So the first and most common test is urea breath test. It is the most common test for H. pylori. It measures the amount of carbon dioxide in your breath after you drink a special solution that contains urea. H. pylori bacteria break down this urea into carbon dioxide, and excess carbon dioxide in your breath is a sign of H. pylori infection. Another test that we use is a stool test. A sample of your stool is tested for H. pylori. We do a lot of stool testing for H. pylori and other bacteria and parasites and viruses in our clinic, as it is very pertinent. Another way to test H. pylori is a blood test. A blood test can show you if you've ever had an H. pylori infection by checking if you have antibodies to it, but it can't tell if it's an active infection or not, because antibodies can stay in your blood even after an active infection is gone. A more invasive test entails endoscopy, and you probably know that during endoscopy a camera is used to visualize your stomach, and then a small sample of the stomach lining is taken and sent for pathology to look for H. pylori. So let's say you are diagnosed with H. pylori infection. What is the conventional treatment? The conventional treatment entails antibiotics and acid-suppressing medications. As far as antibiotic, 2 different antibiotics are prescribed to kill this bacteria, and common antibiotics used are amoxicillin, clarithromycin, and metronidazole. Conventionally, an acid-suppressing medication is added. These common acid-suppressing medications are probably familiar to you. They're called proton pump inhibitors, for example, omeprazole. Also, medication such as Pepto-Bismol is used. It is used to protect the stomach lining, but it is not the main treatment medication. So a common prescription plan would include 2 antibiotics, as mentioned above, and a proton pump inhibitor, or PPI, for the duration of about 10 to 14 days. Some of you may know that there is a controversy in using a proton pump inhibitors, as they have been found out to be carcinogenic, and they also adversely affect gut microbiome. However, at this stage, they're still part of the official guidelines for treatment of H. pylori. There are alternative options in functional medicine, but they are not the standard of care at this point. A common question is asked whether there is a need to treat asymptomatic H. pylori that is incidentally found, meaning that you have no symptoms from it, but it was found, let's say, during your stool test. H. pylori bacteria can lead to ulcers in your stomach and small intestine, and it may also lead to stomach cancer. Because of that, even if it is asymptomatic, it should be treated. So let's tie this with this astonishing recent finding from McGill University. Researchers have now found out that individuals aged 50 and over with a clinically apparent H. pylori have an 11% higher risk of developing Alzheimer's disease. This risk increases to 24% if you've had this infection for 10 years, suggesting a long-term impact of this infection on your brain health. So what does it mean? The possible explanation is in a gut-brain axis, which is a communication network between your gastrointestinal tract and between the brain. And this axis allows the gut and brain to influence each other's functioning. The gut microbiome that composed of trillions of bacteria, fungi, viruses, plays a crucial part in this communication. Chronic H. pylori infection and the resulting inflammation may disrupt the balance that leads to release of these pro-inflammatory cytokines and other inflammatory molecules that can affect the brain. These pro-inflammatory substances can cross the brain-blood barrier, potentially causing neuroinflammation. That is the inflammation of your brain. Neuroinflammation is a known factor in the development of progression of neurodegenerative disease such as Alzheimer's. Additionally, H. pylori infection can impair the absorption of essential nutrients like vitamin B12 and iron. These nutrients are crucial for maintaining the brain health and our cognitive function. Vitamin B12 is vital for production of myelin. Myelin is a component of the protective covering of the nerves, and it prevents neuron damage. Iron is essential for oxygen transport and energy metabolism in brain cells, and not only brain cells. Deficiency in these nutrients are associated with cognitive decline and dementia. So what are the implications of this study for Alzheimer's disease prevention? This finding suggests that identifying and treating H. pylori infections could potentially reduce the incidence of Alzheimer's disease. By eradicating H. pylori, it may be possible to decrease inflammation and nutrient deficiencies that contribute to the cognitive decline. Overall, this research highlights the importance of considering gut health in the context of brain health. The traditional view of H. pylori as merely a cause of stomach issues is expanding. Maintaining a healthy gut through proper nutrition, regular medical checkups, and timely treatments of infections could be crucial for protecting brain health. This holistic approach underscores the interconnectedness of our body systems and the need for integrated health strategies that address both our GI, gastrointestinal, and neurological brain health. Thank you so much for watching. Until next time. Bye-bye.